Well, late yesterday, the first probable Michigan case of monkeypox was reported by the Michigan Department of Health in an Oakland County resident. There was very limited information released other than to say that the individual is currently isolating and does not pose a risk to the public. Our Dr. Frank McGeorge joins us live with what people need to know about this virus. Doc?
Yeah, Kim, as of yesterday, not counting the Michigan case, which has yet to be confirmed by the CDC, there have been 351 cases of monkeypox confirmed in 27 states. Now, most states only have a single case, but New York and California have identified 72 and 80 cases respectively. So the real question is, now that there's a case in Michigan, what is the average risk?
I think it would be risky to classify it as low, medium, or high. Given the numbers, I would not say right now at this particular point that it is a, quote, high risk. But the numbers may increase, which means we've just got to be careful and pay attention.
Local experts agree.
Everybody's worried this will be the next thing, right? COVID started out as a few cases, and whatnot. But this is different. It doesn't spread the same way. It's not nearly as contagious.
Dr. Matthew Sims, medical director of infectious disease research for Beaumont Health, says the primary mode of spread is contact.
Contact with the lesions that you can get, the rash, or occasionally if they have lesions in the mouth, it can spread through large respiratory secretions that only travel a short distance.
He notes, so far, most cases have spread through a particular type of contact.
This is still contact. It just happens to be contact during sex. And it's primarily been with men who have sex with men.
The U.S. plans to distribute nearly 300,000 monkeypox vaccine doses. The CDC is prioritizing initial access to the vaccine to communities with the highest number of cases and people who have been in close contact with someone who's been diagnosed with the virus.
Now, big picture, although monkeypox has largely spread in a population of men who are intimate with other men, some of those same men are also intimate with women. And so this should not be considered a sexually transmitted disease that's only spread through certain types of contact. Anyone concerned about possible exposure should contact their local health department.
Yeah. Well, Dr. McGeorge, aside from the rash that we've all seen the pictures of, are there any other symptoms that people should know about?
Well, it takes about 1 to 2 weeks to become symptomatic, and many of the initial symptoms are fairly generic: fever, body aches, fatigue, and so on. But there's also notable lymph node swelling, and this can happen with other infections too, but it is more common and consistent with monkeypox. So the combination of swollen nodes and even a localized rash can really be a big tip-off.
Yeah. Okay, Dr. McGeorge.